In general, a splint should be A. Loose, so that the victim can still move the injured limb. B. Snug, but not so tight that it slows circulation. C. Tied with cravats over the injured area. D. None of the above. Answer is B. Snug, but not so tight that it slows circulation. A victim has lost a lot of blood through a deep cut in his leg. He is breathing fast and seems pale and restless. He is probably A. Having a stroke. B. Having a heart attack. C. In shock. D. Choking. Answer is C. In shock. Which would you do when caring for a seizure victim? A. Remove nearby objects that might cause injury. B. Place a small object, such as a rolled-up piece of cloth, between the victim's teeth. C. Try to hold the person still. D. All of the above. The answer is A. Remove nearby objects that might cause injury. Why should you cover burns with a clean or sterile dressing? A. To prevent infection. B. To cool burned area. C. To keep the burned area warm. D. Both A and C. The answer is A. To prevent infection. A woman has fallen and turned her ankle. She says she heard something snap. She looks pale and is sweating. What should you do? A. Have the victim walk on the injured ankle. B. Care for the injury as if it were serious. C. Apply heat and elevate the injury. D. Apply a dressing and loosely bandage. The answer is B. Care for the injury as if it were serious, which should be part of your care for a severely bleeding open wound. A. Allow the wound to bleed in order to minimize infection. B. Apply direct pressure and elevate the injured area. If no broken bones, C. Use a tourniquet to stop all blood flow. D. Both B and C. The answer is B. Apply direct pressure and elevate the injured area. If no broken bones. You have tried to control a victim's bleeding with direct pressure and elevation, but the bleeding doesn't stop. Where would you apply pressure to slow the flow of blood to a wound on the forearm? A. Outside the arm midway between the shoulder and the elbow. B. On the inside of the elbow. C. Inside the arm between the shoulder and the elbow. D. Any of the above will slow the flow of blood. The answer is C. Inside the arm between the shoulder and the elbow. Where is the carotid artery located? A. Inside the wrist just above the hand. B. On the neck to the right or left of the windpipe. C. Behind the kneecap. D. Inside the arm between the elbow and shoulder. The answer is B. On the neck to the right or left of the windpipe. A person who is unconscious, not breathing, has a weak pulse, needs A. CPR. B. Heimlich maneuver. C. Rescue breathing. D. Back blows and chest thrusts. The answer is C. Rescue breathing. When helping an unconscious choking victim, you would give an adult chest thrusts. For an infant you would give back blows and chest thrusts. A. 3-3-3. B. 5-3-3. C. 5-5-5. D. 3-5-5. The answer is C. 5-5-5. When performing adult CPR you give A. 2 slow breaths and 30 chest compressions. B. 1 slow breath and 10 chest compressions. C. 5 slow breaths and 10 chest compressions. D. 3 slow breaths and 15 chest compressions. The answer is A. 2 slow breaths and 30 chest compressions. When performing CPR on a child you give A. 4 slow breaths and 20 chest compressions. B. 1 slow breath and 5 chest compressions. C. 2 slow breaths and 10 chest compressions. D. 2 slow breaths and 15 chest compressions. The answer is B. 1 slow breath and 5 chest compressions. When giving care for external bleeding, what should you do first? A. Elevate the injury. B. Apply direct pressure. C. Apply a loose dressing. D. Apply a tourniquet. The answer is B. Apply direct pressure. When caring for a victim who has an object impaled in their hand, you should A. Remove the object, flush with cool water, and transport to hospital. B. Immobilize the object by placing several dressings around it. C. Break object off where it sticks out and bandage injury. D. None of the above. The answer is B. Immobilize the object by placing several dressings around it. When caring for a victim with a bloody nose, you would not A. Apply an ice pack to the bridge of the nose. B. Apply pressure to upper lip just beneath nose. C. Have the victim sit with head tilted slightly forward while pinching the nostrils together. D. Have the victim sit with head tilted slightly backward while pinching the nostrils together. The answer is D. Have the victim sit with head tilted slightly backward while pinching the nostrils together. Which symptoms would indicate internal bleeding? A. Rapid weak pulse. B. Skin that feels cool or moist, or looks pale or bluish. C. Excessive thirst. D. Tender, swollen, bruised, or hard areas of his body, such as the abdomen. E. All of the above. The answer is E. All of the above. A first-degree burn. A. Involves only the top layer of skin. B. Is red and blistered. C. Destroys all layers of skin. D. Is the most serious of burns. The answer is A. Involves only the top layer of skin. When caring for someone who has suffered an electrical burn, you would not A. Check breathing and pulse. B. Check for possible fractures. C. Cool the burned area. D. Treat for shock. The answer, C. Cool the burned area. Signals of an allergic reaction to a bee sting are A. Feeling of tightness in the chest and throat. B. Swelling of the face, neck, and tongue. C. Rash, dizziness, or confusion. D. All of the above. The answer is D. All of the above. When caring for someone who is suffering from frostbite, you should not A. Soak affected part in warm water 100 to 105 degrees. B. Rub vigorously until skin appears red and feels warm. C. Handle area gently. D. Avoid breaking blisters. The answer is B. Rub vigorously until skin appears red and feels warm. Hypothermia. A. Is not life-threatening. B. Victims must be heated up as fast as possible. C. Is caused by exposure to temperatures below freezing. D. Can be caused by swimming in waters below 70 degrees. The answer is D. Can be caused by swimming in waters below 70 degrees. Snake bites can be very serious. When caring for a snake bite victim, which should you not do? A. Wash wounds. B. Apply ice. C. Keep bitten part still and below the heart. D. Get professional medical care within 30 minutes. The answer is B. Apply ice. When should you give rescue breathing? A. Conscious choking victim. B. Unconscious choking victim. C. Unconscious, no pulse, not breathing. D. Unconscious, not breathing, but has a pulse. The answer is D. Unconscious, not breathing, but has a pulse. What do you do for a chemical burn? A. Flush with water, dry, and cover. B. Flush with large amounts of water and cover. C. Flush with large amounts of warm water until help arrives. D. Flush with large amounts of cool water until help arrives. The answer is D. Flush with large amounts of cool water until help arrives. What do you do for a victim who has a bleeding injury to the mouth and you are sure that there is no head, neck, or spine injury? A. Keep victim seated with head tilted slightly forward. B. Keep victim seated with head tilted slightly backward. C. Have the victim lie down on their side. D. None of the above. The answer is C. Have the victim lie down on their side. What is more serious? A. Heat stroke. B. Heat exhaustion. C. Heat cramps. D. Heat rash. The answer is A. Heat stroke. To encourage people to help others in emergency situations, most states have enacted laws which protect you, as a rescuer, from being sued. This is called A. The Goodwill Law. B. The First Aid No Fault Law. C. The Good Samaritan Law. D. There is no such law. The answer is C. The Good Samaritan Law. Signals of head and spine injuries are A. Blood or other fluids in the ears or nose. B. Unusual bumps or depressions on the head or over the spine. C. Has seizures, severe headaches, or slurred speech. D. Both A and B. E. All of the above. The answer is E. All of the above. Is any answer is, doctor advice that is the answer. If you don't know the answer, just click on long sentences and answer. Is there any yes or no question? The answer will be yes. Any question, true or false, the answer will be yes. Attend your exam, earn pass marks is there. Any doubt please, ask as a comment, subscribe my channel. Thanks for watching.